And as I have gotten to know Alex, I have been really kind of overwhelmed at all of the things that he has been involved in. And most recently, he managed to get the Vanderbilt Medical Center 5-Pillar Award, which is a heck of an accomplishment, I have been told by some of my doctor friends. And he also, this past year, got the Community Service MVP Award from Nashville Soccer. And so he's playing all kinds of different roles in our community. He was chairperson of the Adventure Science Center. He has got awards galore from the Chamber of Commerce and from the Francis Guest Connector Group and from Nashville Public Education alumni. He is a product of Nashville Public Schools. He went to Hume Fogg, absolutely. I'm sorry. He went to MLK. I knew where you went, Alex.
I was going to stop that one. I don't stop an intro usually.
But. Yes, you would have. Where he was actually the best friend of one of my best friend's sons. So it's kind of a funny thing I've got going here with him. But he went to medical school at University of Tennessee in Memphis, did his residency or part of his residency in Memphis. And then he went on and went to, George Washington University for his undergraduate degree. He has a master's of management from Vanderbilt in healthcare. He was at Campbell Clinic in Memphis, and then he did a trauma fellowship at Hennepin County Medical Center and is head of orthopedic trauma at Vanderbilt. So this is a man who wears many, many different hats. And on top of that, he happens to be married and he has 3 children. And I have to say this, all daughters. So I have a feeling in your life as a father, you've learned a whole lot more than you thought you would learn. And most of all, I have to share something that I have been told personally by another friend. And that is, he came here when he was 6 years old. His family immigrated here from the Middle East. And when he decided after medical school and after residency to come back here, he came back here because he felt very strongly that he owed Nashville something. And he has committed himself to paying Nashville back for all Nashville did for him and his family back in the day. So Alex, with all that information, I am delighted to have you. And let me just say, go. I've sent him a lot of questions that he's going to respond to. And then this is going to be more give and take than a straight lecture.
Yeah, thank you. Seriously, thank you all so much for this opportunity. This is really neat. And I see Susan Benningworth is on this and
yes.
This call, and almost like a second or third mom to me. So it just really is an honor to be with you all tonight or this morning, whatever time it is. I've been up since about 3 this morning, which is one thing I've learned in this process. But what I was hoping to do is, I think the discussion I was planning on having when I first was invited, and then even a week and a half ago, has changed. And so what I would like to do, if you guys would, is maybe give a sense of, I don't think I can do this talk without speaking about COVID and kind of where we were, where we are, and where we may go. But then I very much appreciate the fact that the League of Women Voters wants to know more about healthcare and public health of Nashville more broadly. And as the chair of the Board of Public Health, I would love to speak a little about that. And then I would really welcome any dialogue that we can, you guys would like to have. So with that said, let me kind of give a sense of where we were. So as of today, 103,645 Nashvillians have been infected with COVID. So that's more than 1 in 7 Nashvillians have now been infected. We currently have 2,980 people who are actively infected. And to put that in perspective, that is a number that we last saw last August, right? And so this is a while back. And on July 4th, or the beginning of July, when we were planning this discussion, we actually only had 444 cases. So from the beginning of July to the beginning of August, we have now gone from 400 to 3,000 active cases. At our worst, which was around Christmas Day, we had 7,400 active cases. So we've been worse. And I want you all to not lose sight of that, because I think sometimes when we're looking at the news and we're speaking to our friends, it seems like we've lost all hope. Everything we've done is for naught. And I just think it's important as a message to say, don't lose hope, because we'll get through this, and we've been through worse. So that's kind of my spiel there about that. But here's what we're seeing now, and I'm sure you've seen this in the news now, is more and more of these cases are patients who have what we call breakthrough cases. So a breakthrough case is someone that's been fully vaccinated, and then they turn positive. In Tennessee, there are about 2.7 million people who are vaccinated. We've seen 1,600 breakthrough cases. Of those 1,600, 195 are hospitalized and 27 have died. So extremely low percentage. In Davidson County, we've had 339,000 people vaccinated, 572 breakthroughs, 17 hospitalizations, and 2 deaths. And I know it's a lot of numbers, but the gist is this. Out of 339,000 nationals who have vaccinated, 2 have passed away from COVID. Where in Nashville, we have seen 951 people who have died from COVID. And so it's really critical to point out, think about the number of people that have been unvaccinated died. This is still a problem of the unvaccinated. Now, one question. So again, I would do this talk a week or 2 ago and would brag about how great we're doing as a city. And the metric I'd use is death rate. Now, 951 individuals have died in their city, which is never great, right? I mean, but that leads to a death rate of 0.93%. If you look at Tennessee, which now has, nearly 900,000 cases, 12,800 people have died, or 1.4%. In the U.S., where it has 35 million cases, 615,000 died, or 1.8%. So our mortality rate in Nashville is actually half of the national average. And I think that's, I would give that some credit to our health systems and the fact that there's so much knowledge and accessibility to everything from the antibodies, infusions, and so forth. Now, if I can just continue a little bit more numbers, and I promise this isn't going to be all numbers talk, but I think this is a good base thing. Nashville has also done really well with vaccinations. We have 54% of our city has had at least 1 dose of the vaccine, and 49% of the city has been fully vaccinated. Compared to Tennessee, which has 45% having 1 dose and 39% having fully vaccinated, we're doing really well. In fact, we are almost in line with the 50% US rate for fully vaccinated. So I think as Nashvillians, we should be very proud of that. More specifically for me, what was really critical for me and the health department was, obviously you guys have seen that this is a virus that disproportionately impacts minorities as well as our elderly. In fact, 91% of people who've died from this are over the age of 55. So we really wanted to be very deliberate in making sure that the people over 55 received the vaccine first, and we did it in a very equitable manner. And so I'm proud to say that today, over 80% of those over 55 have received at least 1 dose of the vaccine, which I think is a really great number. And what is more critical for me, or equally as critical, is of the African Americans that are over that age, 53% have received the vaccine. Of the whites who are over that age, 58% have received that vaccine. And of people of Hispanic ethnicity, 76% have received the vaccine. So we've tried to do this in a very equitable manner so that one population is not left out. So kind of more numbers is what else did Nashville do as far as testing? You know, we tested over 1.3 million people. We vaccinated, we tested 153,000 just at the Nissan Stadium site. We vaccinated 117,000 people. This is Metro Public Health at a Music City Center, and have held over 375 pop-up events, which have vaccinated about 22,000. So as a city, I'm really proud of how we've moved forward. But there are some lessons I have learned in this past 18 months that I want to share with you. One is, I think the way that our healthcare systems have come together in an unprecedented way leads to some of the successes we've had. From literally the 3rd day of COVID, all the health systems who are typically very competitive came together and worked together to take care of patients, to provide free staff for our testing centers. They've all come together and actually now have had to implement a policy that we laid out in the winter so that people who get sick or injured in Nashville can come to Nashville hospitals. Because as you all know, hospitals are getting full again. Before, in the wintertime, there was not that policy, and literally we'd have to ship people to other parts of the country. And we as a community said that's not how we want to do things, and we made plans. And I've also realized there's such strong community organizations, Red Cross, churches, civic organizations such as yourself, and groups such as Hands on Nashville and federally qualified health systems and minority groups and that are focused on getting people out, all came together and made our group really successful. But there are also lessons learned about disparities and really disparities around housing and healthcare and opportunity. I mean, you look at individuals who couldn't take time off from work in March when this happened and who lost their job and lost their homes. And that disparity is something that I would love to talk about maybe a little bit more, and we can get into that a little bit. Now, I want to just take a minute there, and I can either go into some of the questions that are listed or maybe talks about our non-COVID stuff for the health department. Carol or whomever, I'd love to be directed, and I'll have a discussion around that.
Sid, I would love for you to go in a little bit different direction for a few minutes.
Sure.
And tell us what you think is on the horizon and where you see us going right now in meeting some of these inequities. Mm-hmm. If anybody else would like to jump in here, please do. Sure.
So I think that one thing that when I took over as chair of the Board of Health in October of 19, I'll be honest with you, I didn't fully appreciate the inequities in our city as much as I do now. And this appreciation came from obviously what I saw with COVID, the fact that early on, our mainly immigrant population, which really resonated with me, were being so disproportionately impacted in regards to not just health, not just access to healthcare, but also access to housing, access to employment, the inability for them to say, I'm not going to go to work today because somebody in my family has COVID, but I don't want to lose my job because I also need that to pay for that house or apartment that somebody's staying in. In fact, I had somebody who cleans homes who's known me in a friend manner call me once because somebody who had employed her was forcing her to go to work even though his whole house was full of COVID, right? And it's just that inequity really was a problem. And then you look at Nashville in general, where you have the most incarcerated population in 37208. Look at Nashville, in which you have in the Napier neighborhood, literally we had 50% of children not live to age 1 a few years ago, and the public health department got a grant called the Strong Babies grant and project that now has changed that. So what does that mean for health? Well, what it means for Metro Public Health is, as a board, we decided it is a priority of ours to focus on these inequities in our city. And so one of the things we did was we started a Bureau of Health Equity. And we just hired a wonderful person, Dr. Stephanie Kong, who has a PhD in public health from Harvard, who is a Nashvilleian. Nashville, I believe she's also an immigrant to Nashville from Korea, I believe. And I don't recall what school she went to, but public school person who just left working for Congress. And we've just hired her. And in fact, she just started last week to really focus on equity in all policies, not just in health, but across Metro departments. So that's one way we're being actionable on that. The other thing that I think is really neat is public health is typically not a department or a area that is funded so well. But because of all the COVID issues, public health has been funded well. And one of the grants that we received from the federal government was a $5 million grant from the CDC to address disparities, specifically around COVID, but the problems are one that I think can go across. So with this $5 million grant that we've received, what we're going to do is really work to focus on underserved areas, looking at ways we can get not only get focused on people who speak Arabic, Kurdish, Burmese, Spanish, Swahili, focusing on these zip codes and doing things such as health literacy information, having people kind of get into the community and build the trust that is needed. We found one of the most effective ways to vaccinate our Spanish-speaking population was really to partner with Turk and Conexion, who had this great relationship. Sounds intuitive, but it was much, in the heat of the battle, it actually was much harder to do. So we have $5 million that we've really focused on that. The other problem that is really, there's two other problems in the city that are not COVID that I think are important to touch upon. And one is our drug overdose problems. From January 1st to March 31st, we've had 155 fatal drug overdoses in this city. That is, at least about 5-10% increase from this time last year. Approximately 2/3 of these overdoses involve multiple substances. And, this is a problem that's not getting better. And it's not a problem just isolated to Nashville, but it's a problem that Nashville has to deal with. And one of the efforts that we're doing to try to deal with it is we're working with the Partnership to End Addiction. And we launched a program. You might have seen it. If there's a spike in overdoses, that we now make that public, because what's happening is people will go buy drugs and the drug will be laced with fentanyl or something. We're trying to make people more aware that, hey, there is a spike in overdoses this week. Be careful of where you're using. And that has actually shown to be effective of lowering our overdose rate. We are also building a partnership in which we are going into places where perhaps there's more likely to have drugs and people using and offering Narcan and doing other things like that. The other area that we're focusing on is mental health. We're really focusing on mobile crisis to try to make it less toxic for people to obtain mental health services. We've partnered with the Department now with the mental health co-op to try to have people who are trained mental health professionals ride with police to mitigate some of the bad outcomes that have happened sometimes with increasing in escalation. So those are kind of things. And I don't think the program that I'm really proud of, I'm proud of a lot of our programs, is the Safe Babies program that I sort of alluded to earlier. Again, Nashville has a high infant mortality rate, especially in African-American populations. And it's hard to believe we're literally in a first world country with some amazing health systems. And that when my daughter was born at Vanderbilt University Medical Center, right down the few doors here, the same moment there was another daughter of somebody's who was born and stayed in the room next to him. Same medical team, same resources. And just because I live in 37220 and that child may live in 37208, my daughter will live 12 years longer, assuming all else is equal. And that long-term inequity is something we need to address. COVID has highlighted, but we need to really be more deliberate about how do we address that. And then more so the first year infant mortality rate of 50% in the Napier neighborhood. Programs such as the Safe Baby program we now implemented, which places people in the community to help train new mothers throughout the entire pregnancy process and afterwards, has been shown to greatly reduce the infant mortality rate in that neighborhood, and we've increased it broader. So perhaps I will stop for a minute there, as I've done a lot of speaking, and happy to address any of or all of these or some of these written questions as well that were provided. Carol, I believe you're muted.
Why don't we at this point go to some of those written questions, unless somebody has a question that they'd like to ask right this second. And if you do, unmute and jump in, please.
All right. One of the questions is regarding vaccine supply and are we at a risk of it expiring? The short answer is I think we as a county have done I think we're a model for the state of how vaccinations should happen. The risk of vaccines expiring in our jurisdiction is really low, and honestly, probably across the state now is low, because we've had processes and supply chain management that kept it going. Remember, there was a big winter storm in January or whenever it was, February, and we were at risk of expiring, but we were able to quickly pop up a clinic off Jefferson Street, and vaccinate people. I actually drove the vaccines in my SUV to the site. So vaccine supply is really great here. I wouldn't worry about it. And then would we have any difficulty accommodating the boosters? I don't believe so. When the boosters are approved, and I think it is a when rather than a if, there is now so much supply and processes, both Metro Public Health, but also our health systems, grocery stores, pharmacies. I think that it's going to be very easy, especially in Tennessee, to get a booster shot if you so would like. Now, there was one question. I appreciate someone asking this. Can we discuss the new funding that came to the department from COVID relief packages and how this funding is prioritized? Now, this funding is amazing. We as a city, so the state of Tennessee from Memphis and Nashville received $50 million. As a city, we received 26 million of that 50 million. And this is in addition to the 5 million I discussed earlier. Now, what this funding is for is really looking at how do we prepare for the next, or how do we continue our COVID response, and how do we perhaps prepare for the next pandemic? Here's the thing: 7 million of that funding is already spent. We ended up paying for temps. We ended up paying for supplies. Restock our PPEs. All these things that for the past 18 months we've been paying kind of out of pocket, I guess is a good way to put it, but essentially using all of our tax dollars to pay for, knowing that, hoping eventually we would get some of that reimbursed by the federal government, which we now have. But that still leaves $19 million for us to do good with public health. And this is unprecedented, right? That amount of funding in a health department all at once, I mean, it's not it almost never happens. So we're excited to have the opportunity to use this. And some of the things that we're looking to fund would be testing at safety net clinics, projects to help alleviate some of the capacity issues at shelters for the unhoused. I'm proud of, given how short of notice we had, to help our unhoused Nashvillians have a safe place to go, self-isolate, have food, keep all the stuff that you and I may take for granted when we were asked to social distance. We can now try to use some of this funds to make that more of a permanent thing for Nashville. The issue of food and income security I've mentioned a few times. We would hope to use some of this funding to, again, add funds that will allow people to have that food and income security so they can take care of their health first before they do, before jeopardizing their health and others because of a job or housing issue. And then I think we're going to continue funding positions in epidemiology, case investigations, a lot of the peer-based educational programs, especially that encourage vaccines and so forth, especially across multiple languages we have here in Nashville. And then we'll continue working with critical partners to continue building this. And I think it's important that beyond maintaining adequate supplies of personal protective equipment, the best preparation, honestly, to improve the health of our communities is to really envision a new normal where the health disparities and health inequities are minimized. And I know I've said that in different ways multiple times, but I think that is the biggest lesson for me. And I hope part of this 26 million or 19 million that's remaining will help towards that. All right, let me see. Can you discuss vaccines? Here's something. I think I can share a screen, so I apologize. So this is a question around how are our counties vaccinated? Can you guys see that well?
Yes. So
this is, and let's see if oh goodness, I get these reports which are really fun to geek out on. But this is the vaccine thing. So the darker the color, the more people are vaccinated per capita. And here you go. So if you can see, the southwest corridor of our city early on was vaccinated more heavily because I think there's a lot of healthcare workers here. But some of the North Nashville area, our immigrant population is more down here. We've tried to be deliberate and where we set up, if you our testing sites initially, if you remember, were in North Nashville, Nissan, and down here. So somebody asked me, why didn't you set up a testing site down in Belmead? Well, there's resources for people to get tested. And I think that was very important. But this is a neat map for the question around vaccine distribution in our city. Again, as a city, we are doing on par with the national average, which I'm proud of. Let me see if more vaccine stats. These are just vaccine stats. This is how many doses are given. The red line's average. You can see that there's a little uptick. So people are again getting more vaccinated, which I'm happy about. But anyway, that's that. I don't. And then the final written question is one that I try to avoid, but I'll dive into it with a group interested in policy and politics. Is given the state legislature has a restriction on the authority of the Department of Health to promulgate emergency health measures, can you discuss who's in charge? So what this is about, and this became so evident. I mean, it's become evident several times for me, but it's yesterday about the decision for Metro Public Schools to mandate masks. It was shown in the history. So a little bit of national history, and I apologize if some of you know this. But the first department in Nashville Metro to become consolidated, to show that a consolidated government can be effective, was the health department. Dr. Lentz, from what I understand, was very, he was savvy at how he did things. He got the mayors to agree that, hey, let public health be an entity that covers all of Metro. It actually led to a really interesting how he wrote the bylaws that are in the charter. So one of my things I'm going to do as chair is try to change the bylaws in the charter, because they're very, public health's different than it was in the 60s. But it was part of Metro government that was the first part that came together. And by Metro charter, the public health department was set up differently. For example, the director of health reports to the board of health rather than the mayor. Obviously, the mayor gives our budget, so we want to make sure that the mayor is on board with a lot of the things we're doing. But the state of Tennessee had also, over many years, had given the 6 metro areas that have their own independent public health department the ability to declare a public health emergency. And that is how we were able to declare a public health emergency that then allowed, and this was in early March, and then allowed the director of health to allow mask mandates or restrictions on space and so forth. Well, because of a battle out of Knox County and their county mayor, who's a former wrestler, and that's more descriptive. It's not opining one way or the other, but I forgot his name. He's a former wrestler. He didn't like what the director of health, who, sadly enough, she resigned yesterday after 18 months. The county mayor didn't like that the director of health and the board of health had the ability to declare a public health emergency to keep the Knox County safe. And so through the state legislature, they've now taken that power away from the boards of health. Fortunately, they've at least given the county mayors that ability, but before it was just going to be the governor. So in Nashville, typically, I don't think it's going to be as big of a problem, because I would hope that our county mayor and who's our city mayor typically will rely on the experts. Mayor Cooper, whom I had not met prior to this, does rely on the health experts. And I appreciate that. And I would hope, I've known, like probably many of our previous mayors, and I think every one of the mayors I've met to this point would listen to the experts. And so I don't think this is as much of a problem in Nashville. It will be more of a problem perhaps in other jurisdictions. But the question of who's in charge, I guess the county mayors, but there's a lot that still hasn't been tested that the lawyers in Metro and I talk about as early as yesterday. I mean, as recently as yesterday, we don't fully understand with 100% certainty. So thanks for the comment about the father. When are vaccines for under 12 years likely to be available? I hear that there is a likelihood within the next 2 or 3 months. And so for me, this is where people have asked me, why have we not implemented another citywide mask mandate? And the reason you have mandates is Public Health 101 says you have to intervene with a public health intervention. So whether it's a mandate for masks, whether it's restrictions on hours and capacity, you do that until there's a effective, accessible intervention available to mitigate the virus or whatever the public health emergency is. In this case, we have that on the vaccine for everyone over 12. So I don't believe, I think at this point, now that the vaccines become very easily accessible, I don't think it's good policy, and there's a lot of implications to have mandates around certain things for adults. So that's why I believe that we don't need to go down the mandate rule across the city. Now for kids, it's different because 12 and under are not vaccinated. I worry every day for my 7, 8, and 10-year-old daughters because they're still not able to be masked. They're not able to be protected. So we wear a mask out in public. I wear it to model for them. This was before the CDC's recommendation. I hope the vaccines come in the next couple of months for them. And then can public school systems do a parental opt-out form and then provide in-school clinic for vaccination of all young people who's, well, that's a little more complicated. Can the public schools, there are ways one can opt out if the of a school's rules, and you know, it's religious and medical, and who am I to judge what one's religious or medical reasons are? But I would hope people would be sincere about that, and we do both. We all know that may be a little iffy. And as far as vaccinating all young people, when 12 and under are able to be vaccinated, Metro Public Health will work with the schools as well as with other partners to make sure we make it as accessible to the 12 and under as we did for everyone above. So that's really a priority of ours, and we'll make sure to do that. Now, are there ethnic communities that are particularly vaccine resistant? You know, surprisingly, more and more, it's really become, I mean, you guys have heard this, is the rural white ethnic group. People of Hispanic ethnicity, because of great partnerships with Turk and Conexion and Plaza Mariachi has like vaccine drives all the time, have actually done fairly well. The African-American community, my gosh, the church leaders that I've worked with have been literally a godsend of building trust. Because I believe when it comes to who's going to get the message out now, I'm a talking head, right, on a screen. I mean, I think the people I would have reached, we reached at the beginning of this. And now it's really the pastors, the community organizers, the capacity as a doctor, like I do speak to my patients about that. And I think people respect that more than, again, being a talking head. And that's what we need to do. That's why, so one of my calls to action of this group was actually going to be is please don't think that you can't get people to the finish line with vaccines. Advocate for that. Be the influencers that you are. That is a critical thing. So I hope that answers that question. But again, I feel like I'm talking a lot. So please throw me anything. I'm gotten good at this random question thing. Anyone? I also oversee animal control as Board of Health, and I want to say our shelters have done well, and it's amazing how it's interesting. We during the pandemic, we did really well at adopting, and now as people are getting back to their lives, shelters are getting full again. But Metro's shelter, you guys may not know this, is a no-kill shelter. We've done such a great job at adoptions and fostering programs that our euthanasia rate is so low. I know that's totally random, but I think when you're looking at overall public health of the city, I mean, the animals and so forth are part of that. So anyway.
I actually find myself wondering, after everything that was in the paper in late July, I believe, the Metro Health Department's relationship with the State Health Department and the problems there as they impacted on the Metro Health Department.
So the Metro Health Department, so this relationship between the Metro Health Department and the State Health Department has always been strong. I think by maybe a grace of God or whatever, I personally have had a great relationship with Commissioner Piercy and a lot of her staff pre any of this. And I bring that up because there are a lot of things that we have done. For example, the Nissan Stadium mass vaccination event came about because the commissioner and I, about once a month, would go have cocktails. Somewhere very quiet, somewhere that people wouldn't say, look at these two people not socially distancing. But we do it carefully. But I say that to say, I think one thing that I hope, another lesson learned for me is the lack of civility in policy and politics is there's a real impact, right? I mean, this is not scoring points, and in no better way have we seen this in this capacity of what we're doing here in health. And so, I think the commissioner and I have our friendship and our relationship, and let me be very clear. I mean, I don't know how many of you know me from my, I guess I like to think I'm not political, but I guess I inevitably am now. I'm a political appointed person now, but like, I'm definitely a center left. If you look at where I've donated, I mean, I'm definitely not where the commissioner is, right, and where the Lee administration is. But that's never impacted me, other than we have some very lively discussions around issues around, expanding Medicaid and issues around, things that you'd expect. But when it comes to the pandemic, we all share within the Department of Health, state and the government and us. We all want people, Nashvillians and Tennesseans, to do well. And so, the relationship has been great. The mass vaccination event that came about in Nissan Stadium literally came from, she and I were having drinks, and she's like, if I told you I can give you all the Johnson & Johnson vaccines that you want and could help you out, could you do something really big? And that was her charge to me, and we did. When it came at that same event, Shelly Fiskus, who ran our vaccine program for the state, she literally came over and drove a golf cart around to help give people waters and so forth. Shelly Fiskus also is the one that would call us and me personally when there were vaccines maybe expiring in another county that weren't being used, because she knew we had the operations to get it done. Because the mission of the state health department is to make sure as many Tennesseans were vaccinated as possible. If I could help that on a local level, the state would help. And it was beyond that, right? I mean, I've spoken to a lot of the senior leadership of the health department in the past few weeks, because it's been a hard time for them, right? I think we can get caught up in the politics and the he said, she said part of it. But these are some dedicated professionals at the state and our county level for sure, and at the state level that just do good by the state, by the people of Tennessee, and the politics unfortunately sometimes hurts. But the relationship is great. That was a long answer to your question, but it helped me from this civility thing. Does your department receive support info? The question from Ms. Clinton, we talk to other health departments. I mean, Knox County, Memphis, Dallas, very, very self-serving. I think we as a city have been a really good model for a lot of places. So a lot of people call us, right? And I'm really proud of that. And it's the leadership team we now have in the Department of Health. I mean, you guys have probably, maybe you weren't aware, but we, middle of all this, we changed our director of health. We didn't skip a beat. In fact, we got better after that. And it was because there's so many great people who have these great relationships who again, dedicated to the cause of public health. And these other blue cities will call. But, I don't know. We try not to get into the fray too much there. So question of, since there are no interventions for kids under 12, why not require masking to protect the young? Well, I think I've been very vocal about, I believe masking should be at schools as consistent with the CDC. And I think, how do you enforce a mask mandate for kids in a public space outside of schools? And I think that there's maybe some logistical problems there. I encourage any parents to do that. And then role for community workers and encouraging masking vaccine. Yeah, community workers, health workers have been critical in our response. We work with Siloam Health very closely with their community health workers. So that's $19 million we have left. We're going to continue funding community health workers. And as we rewrite the Metro Charter, which again was one only job except hiring a director of health, and I took over as board chair, community health workers will become a category of somebody we want to see sit on the board of health. Right now, it's a very MD focused board. Public health is not an MD focused profession. And so we're actually going to lower the number of doctors that have to be there. I mean, you can have 9, but you can have more doctors, but we need people like community health workers, clergy. Right now, there's one nurse position. It's a psychiatrist position. We don't need a psychiatrist per se. We need a mental health professional, maybe a psychiatrist. And so these are some of the things that I think the role of community health workers, and I appreciate that coming up, is one that again, one that I wasn't as aware of when I took over as chair, that I've really grown to really appreciate. Anti-vax movement and long-lasting effect on childhood vaccinations. Oh my God. I mean, who the heck would have, I mean, this is nuts, right? I mean, this is, I mean, the anti-vax movement has now become political, and that's really scary to me, because we actually have seen a decrease in childhood vaccinations. Thank goodness, the past 2 weeks, we've seen an increase in requests for the normal stuff to get you into kindergarten, 7th grade, to school starting. So we have seen an uptick, but we are lagging as a state and as a city in what we would expect. And that worries me. Vaccines, all of us are here because of vaccines, right? I mean, anyway, I can get on my soapbox that maybe some of you share, maybe some of you don't, but I'm happy to debate that more lively if you guys would like. But yeah, it does worry me, the rhetoric around vaccines, because it's more than just COVID that we need. What else, please? I'm enjoying it.
I don't know if you have any questions left from our health team, but
I don't think I do.
I would love for you to talk to us for just a minute about where you would like to see us help you out if we could. We lobby on occasion. We try and work with various departments of both the state and local government. Are there areas that you'd like to see us more involved in?
Well, I appreciate that. So as leaders in the community, as I kind of mentioned earlier, I think advocating for people to get vaccinated in your circles of influence, I have to ask for that, and I suspect you guys may do that. But if there is a more directive approach you guys would like to partner with Metropolitan Health, I mean, we would love that opportunity. Now, when it comes to lobbying and other things, I do believe access to healthcare is critical. I don't know how one can have gone through the past 18 months and not see the need to expand Medicaid, right? And there's ways to have done it. And I don't often take a position on that, but publicly, but it's time, right? I think we need, it's not the end all be all, but having a solution that's not just a faith-based solution for health, which I think some of the people advocate, we need to do it, because I think we've seen the impact. One thing I worry about when it comes to the disparities in COVID is we don't know the long-term effects of long COVID, as some people have said. I think, you look at, I think it was like fibromyalgia or when fibromyalgia had really started hitting the scene, it was mainly older women who were having it, and people were saying, and I'm part of this statement, people were like, oh, they're crazy, right? They're not really experiencing something. Well, that's not true, right? And we've learned that through decades now of seeing and being aware of fibromyalgia and treating it. But what about long COVID, right? And I think especially as our communities of color are more disproportionately or have been more disproportionately impacted by COVID, are we now going to see a group of people who may not have access to healthcare, who can't get over this? And will that impact their ability to get work or ability to have a good quality of life? I think what better time than now to advocate for that. I think we also need to to advocate for civility within this dialogue. I mean, I think the vaccination question that was asked earlier is a really good one. Vaccinations aren't even political. I mean, there's a lot of things I understand that there are very fundamental disagreements, and that is political. I get it. But when it comes to vaccinations, when it comes to public health interventions, why make that political? And then why would you strip the ability of experts to make certain decisions? And that ship's probably sailed, but I'd hate to see further weakening of really dedicated people's efforts, just because it's the political savvy thing to do right now. Anyway, there you go. That's probably the most advocacy I've advocated for in this whole 18 months.
Thank you. Let me go back for a minute to long-term COVID, because I know that that's hitting people and hitting some people very, very hard. And I know in Memphis, they're doing a study on long-term COVID. I don't know if we're doing one here or not. But when people are discovered as having that, often cardio issues come to the forefront with that.
Yeah.
Are we using some of that funding to help these folks get into studies where they might be able to get medical help that they couldn't normally get because they don't have insurance or?
As of right now, no. There's no plans. Again, the reason I say that is because in addition to these funds, I mean, there are probably, and I'm not as aware, funds for health systems to enroll people in trials. The Metropolitan Health Department isn't per se a treating facility, right? I mean, we do some family planning stuff, STD stuff, occupational health, and vaccinations. That's typically our MO for treatment. But it's not to say we wouldn't consider. I would be lying if I told you we had a line item for all 19 million right now. We don't. And there are certain rules around what we can spend that money on. But as of right now, I don't think that's something we thought about. It's an interesting thought though, that I don't have much input other than that. Can I answer one of these questions around Ms. Smith around case that schools could not mandate masks if they were not a mask? So very frankly, that was a spin that maybe some of the school board was putting to school board or elected officials that could mandate masks if they chose, and they did yesterday. And I appreciate the fact. I and Dr. Wright, who's our director of health now, and the board of health, over a week or two ago, advocated for following the CDC guidelines for masking in children. And I did it privately, I did it publicly. But the people who set policy in schools is the school board. As a city, we don't ban pocket knives, but they ban pocket knives in school because it's not the safe thing for kids. And I say that very clearly is I think it was more reluctant to do it rather than I mean, just passing the buck. And I know it's probably recorded and I could probably go bite me in the rear, but the reality was I believe they made the right decision. Children, my kids go to university school. I help USN with their planning. That's what we did at USN, as has now Father Ryan, as has now MBA. So it's not really that other schools aren't doing universal masking consistent with CDC, but that was a really interesting, for me, again, as somebody who's not typically in politics, really interesting. The school part of this whole thing has really been fascinating to me. Maybe not off the record at some point, I give you more of my intake on it, but when it comes to that direct collection, the school board has the authority, and I'm so appreciative that they used it. I know it's tough. I know they get a lot of banter back and forth. But it was the right decision. I'm really proud of the school board for doing that, but it was their decision and not mine or anyone else's in isolation, including the mayor. I mean, the mayor said it for city buildings, but anyway.
I have a really random question.
Yeah.
Has the health department thought at all about doing a campaign about gun violence?
Yes. So I had 3 goals when I took over as chair in October of 2019: hire a new director, change the bylaws, and because of my day job here as a trauma surgeon, literally addressing gun violence, or at least making a position as gun violence a public health emergency. That was my 3 goals. I was going to do it for 1 year. October of 2020, I was going to step down. We had a plan. Well, here we are. So, the mayor and the council have appropriated $3 million to address gun violence now in our city. As chair of the board of health, I actually get the opportunity to sit on that committee. It's like me, Judge Calloway, community leaders, council members. It's actually really neat. Police leadership. And so there actually is an initiative now going on in Nashville. We just gave out a few just small grants for like summer programs and so forth to kind of help kids in the summer. But now there are like $1 million grants, or maybe a little less, that we're just starting to have discussions around doing because gun violence is a problem. I'm not making this up. The surgery I did right before here was a guy who got shot this morning. Like, that's why I was like, oh my God, I was about to maybe miss this because that gentleman rolled in at 6:30 this morning. And I see that more and more than I ever would like now compared to when I started Vanderbilt 12 years ago. Gun violence is a problem here. It's a problem in our city. It's a problem all over the country, but there's a lot of predominantly young men who are dying because of gun violence. And they're predominantly young African-American men. And that's a real tragedy for me.
I see you have one more question down here in the chat box. Could you talk more about addiction in Nashville and or Tennessee? And I think we're going to make that your last question.
Sure. Can I talk more about it? Well, here's what I can say. I'm trying to pull up some stats. So, me and numbers, right? I'm sorry. I'm all into. So what I can tell you is addiction has continued to worsen in our state. And I apologize. I don't have I should be able to do this a little better than I have when it came to addiction. But here's the thing. I mean, we're starting to see, as I mentioned, 155 suspected overdoses, which is on track to be more than 2020 for the year. So that'll come out to about 800 people. What we're seeing more and more is fentanyl was detected in 73% of the deaths here in Nashville, followed by cocaine and methamphetamines were 23%. So fentanyl, especially this fentanyl that is synthetic, is more and more in the overdoses. And this is why we have this now network that we send out messages, and we've got it on the media that there's overdoses happening. Our hope is that some people who may buy whatever other drug of choice will be a little more cognizant. We're encouraging programs where people will, honestly, if they're going to use with a partner, and have Narcan available. And I think this is really critical for us now, because it's going to happen. People are going to OD. People are going to use, but we're just trying to, at the least, minimize death. And I know that sounds like a simple initial goal, or not simple, but like we should be able to do more, and we are. And some of our behavioral health initiatives that more will hopefully put some of that, because I think behavioral health and substance abuse, there's some connection, right? I'm not saying everyone who has substance abuse has mental health illness or vice versa, but there's hopefully that the support systems can be thing. But it's a problem in our city, and I hope that gets answered. So that's kind of my spiel. Thank you.
This has been a wonderful, wonderful presentation, and we deeply appreciate all the information that you've shared with us today. For those of you that are not on video, go on video for a second so we can all applaud him, if you would. So we thank you so much for all that you have shared with us today. You got lots of people coming on here.
Well, you guys are very kind. I hope it wasn't too much rambling, but I really enjoyed this.
No, it has been wonderful information that you have shared with us, and we appreciate your taking the time and the energy, particularly after you got up at 3 this morning. So with that, we bid you a farewell, but I'm going to talk for a second about our upcoming program. And we don't know where it's going to be. And I may go back to Dr. Jahangir to find out what we need to do. We had planned for it to be our first meeting where we could come in person. Whether we're going to do that or not in September is very much up in the air. A little bit closer to September 3rd, I will let you know. But as it stands right now, we're also going to do it on Zoom, by the way. So it would be done both places. If you have strong feelings about getting back together again or not getting back together again, please let me know. Because I would love your input on this. We have a space, we have a place, we're ready to roll with it if in fact we decide to make that decision. Renee Pratt is going to be our speaker. She is the director of Metro Social Services. And about 2 months ago, a whole new community needs evaluation came out. and address the state of well-being in Nashville for the entire city. And I am excited to have her as our speaker because she starts off by saying very clearly, 2020 worsened Nashville's economic and social well-being. So we are not going uphill. We are unfortunately in the process of going downhill. And this has been intensified by hardships across the entire population of Nashville. And so I think it will be interesting to see what she's saying, see what she's hearing, and get a sense of where our communities are going. Those of us who live in certain parts of town, I don't think are at all aware sometimes of all of the things that are going on in our community. And so this will be kind of an opportunity for us to find out a bit more about this. And I'm going to post on the League website the report that they made that's going to be available, and it's Metro Social Services 2020 Community Needs Evaluation Record. I'll post it when we send the notice out about the upcoming meeting. Thank you all for coming. I think it's been a lively discussion, and I hope you all take information away from this as I feel like I do. Thank you so much.
Wasn't he wonderful?
Yeah, he was.
He was fantastic. Where'd y'all find him?
Well, it's an interesting question. I need to get out of here, I think. But
I hope you heard that.
Yeah.
He was very, I enjoyed